Hello everyone. Today we are going to see about the basics of or the introduction to diabetes mellitus. So let's begin. First, diabetes mellitus is a chronic disorder, as everyone knows, and it is a heterogeneous disorder. At first everyone thought that it is a single disease entity, but later they found out that it is a heterogeneous disorder which is characterized by chronic hyperglycemia. Hyperglycemia means elevated glucose level in blood. So which is characterized by hyperglycemia, which is resulting from mostly genetic, then environmental, and also some diverse etiologies are present, which act jointly. So it simply means that it acts jointly, like it can be genetic, or it can be environmental, or it can be genetic plus environmental. So it can act jointly, or it can be caused by a single source. So it is a basic definition of diabetes. And what exactly it is in our body, what exactly happens? Diabetes mellitus, there will be either lack of production of insulin or else defective insulin, which means the insulin will be less sensitive. Usually what is the function of insulin? Insulin is a hormone which plays a crucial role in metabolism of carbohydrates, fats, and also amino acids. So it plays a major role in mainly carbohydrates, which is glucose. So for converting glucose into glycogen and storing them into the muscles, we need insulin. So by that only we can reduce the glucose which is available in the blood. See, in blood, whatever we are eating glucose, in blood it will be available. If insulin is there, its job is to convert the glucose into glycogen and store them into some storage areas like adipose tissue and some other muscles or even liver. So here glucose will be stored as a glycogen by the action of insulin. So this is its job. But what happens in diabetes mellitus, either there will be no insulin or low levels of insulin, or else the insulin will be less sensitive, which means the insulin, even if the insulin is present in front of glucose, it won't respond to that. The insulin will detect that, okay, glucose is high, we have to do our work, but it will be less sensitive, which means insulin is not working or either it is not available. So this is the basic biology or basic mechanism of developing diabetes mellitus. Okay, next, what are the complications of diabetes mellitus? If you have diabetes mellitus, and what are the complications that will develop which will affect your daily life? It can be from cardiovascular complications, or renal, and also ocular, neurological, and also some other complications are there. But these four are major: cardiovascular, renal, neurological, and ocular. These complications are commonly seen with patients with diabetes mellitus. So this is all about the basics or introduction of diabetes mellitus. Let's see about the types. In types, there will be majorly two types of diabetes mellitus, but actually there are a few varieties are there, but it is better to know only two types. The first one is type 1 diabetes mellitus. Second one is type 2 diabetes mellitus. The first one is also called insulin dependent diabetes mellitus. Second one is called non-insulin dependent diabetes mellitus. Why it is called like that? Because the first one, type 1 diabetes mellitus, it requires insulin. That is why it is called insulin dependent diabetes mellitus. The second one is non-insulin dependent diabetes mellitus. Here insulin is not required. You can give any other drug to mimic the actions of insulin. So you can do that in type 2, but in type 1 you can't do that. You should not do that, because there is a reason. Let's see about that. Let's see about type 1 diabetes mellitus. It is also called juvenile diabetes mellitus. Why? Because it occurs mostly in juvenile. It occurs mostly between the age of 10 to 13, I guess. But it also occurs in adults also, but it won't be more than the age of 30. It's a form of diabetes mellitus which occurs in young patients or young humans. So what happens? Why it is like that? Because mostly it is of genetic reason, and in that also the 90% cases are like immune related, and the remaining 10% will be idiopathic. Since it is of genetic reasons, this form of diabetes mellitus is more lethal compared to other types, which means if it is untreated or undiagnosed, definitely it will be lethal, it will be life threatening. So that's what it is considered as a serious form of diabetes mellitus, so which needs a diagnosis and treatment properly in order to prolong the survival. So this is about type 1 diabetes. Next we will see about the type 2, which is non-insulin dependent diabetes mellitus. So it does not require insulin. So what it requires? It requires some other drug to mimic the action of insulin. Like what insulin does, it just converts the glucose and it stores it to muscles and liver. The same job what our drug is going to do. Type 2 diabetes mellitus is more common than type 1 diabetes mellitus, and also it occurs in middle-aged and elderly population, and also it does not need insulin. So there are some medications, like you will see the oral hypoglycemic drugs. You might have saw the classification and pharmacology. I already uploaded a video for oral hypoglycemic drugs. If you have not watched this, I'll just send a quick link here. You just click and see this. So these drugs can be given to treat this type 2 diabetes mellitus, and it is not a lethal form of diabetes mellitus. It is just a usual form, and it can be common than type 1. So it can be manageable. Like if you are taking medications properly and you are diagnosed and treating in a proper way, it is definitely manageable, and the complications also it is manageable in type 2 diabetes mellitus. So comparatively, type 1 will be like lethal form, and it occurs mostly in juvenile, and type 2 is more common, but it occurs in middle-aged and elderly patients, and it occurs not because of genetic lesions, mostly because it occurs over years. So which means your lifestyle or your food style maybe something may be defective or which is not good, which might lead to diabetes mellitus. So it is type 2, but when it occurs because of genetic reasons or environmental reasons, it will be type 1, but type 1 will be less common, type 2 will be more common. And type 1 we have to give insulin. In type 2 no need of giving insulin. We can give the oral hypoglycemic drugs, which are reported to be clinically effective. So these are all about the basics of or introduction to diabetes mellitus. So I hope you guys like this video, and if you have any questions or queries, you can mention it in the comment box, or you can just send a mail to vasantacademy17@gmail.com. So if you want to see these kind of videos, you can subscribe to this channel, and if you like this video very much, you can share it with your friends too. I will see you guys in the next video. Until then, bye from Vasant.